Hi, I'm Priya. Today I'm going to be filming the insulin proficiency video. So this will be just specifically giving insulin as per the scenario given to us. So before I jump into the scenario and explain what I'm doing, I'm just going to go over my pre-assessment. So it's important to, in terms of the pre-assessment, that you're checking for contraindications or things to be cautious about. So for example, that could be, is the patient pregnant, or any allergies that might already be known on their medical file to the insulin. Also checking the doctor's order, and then checking the doctor's order in the MAR. So making sure that in terms of the sliding scale that's the doctor's orders and the sliding scale that the doctor has ordered specifically for the patient, that it is for the right patient, which specific insulin that they've ordered, if there's any contraindications between the ones that he's ordered that you might have to presumably mix. And then the administration time that it's ordered for, the route, dose, and then also checking the insulin vials itself for the expiry date to make sure it's okay to give. And then that's pretty much it in terms of the doctor's orders. And then for physical assessment, making sure that you check the scan to see the injection site, making sure that you rotate it when you proceed to administer, checking if there's any type of lesions or anything that would be of a concern where you're going to potentially inject the insulin. Also, it's important to make sure, are they NPO or eating, that the gluc check was done prior to giving the insulin, and that it was done at an adequate time, that not like hours before where potentially the reading may have changed. And then also any signs and symptoms of hypoglycemia, including nausea and vomiting, and making sure that their vitals are okay, and not that anything that would be of significant anything alarming realistically that would maybe potentially cause you to hold the medication. So doing all those checks, saying everything's okay, we proceed on to the scenario, and it specifies that that I'm caring for a patient who's admitted with uncontrolled type 2 diabetes. They require Novolin NPH, AM and at dinner, and Humalog Lispro QID as per sliding scale. The morning glucometer reading was 10.6. So referring to the sliding scale that's ordered here, doing my check that the doctor ordered it for the right patient, they've dated and timed it, and they've signed off on the order, and they have specifically specified 22 units of the Novolin NPH at breakfast, and then they have selected a moderate dose regimen for this patient. So as per, referring back to their gluc reading, which was 10.6, we will be giving 4 units of the insulin Lispro, which is what we have here. So the Humalog Lispro is the rapid acting, which is here, and then we have the NPH, which is the intermediate acting. So rapid and then intermediate. So one thing to note is that for the NPH insulin, it's important that you roll the insulin between your hands to make sure that the medication is resuspended, because as you can see, all the white particle bits, the sediments are just sitting at the bottom of the vial, so you have to make sure that it's resuspended prior to administering. So I'm gonna go ahead and do that. I'm just doing it gently. Okay, so now that it is mixed, it appears cloudy, and the procedure is going to be cloudy, clear, clear, cloudy. So we're going to inject air into the cloudy first, then inject air into the clear, and then we're going to withdraw. So basically pull up the NPH first, which will be 22 units, and then we're going to pull up from the rapid acting, which will be 4 units, altogether 26 units. So I'm going to go ahead and proceed. But also just, I don't know if I said it before, but these are my alcohol pads to use, my syringe, my injecting pad, sanitizer, and my insulin vials. I'm gonna go ahead and just take off my ring. So I'm gonna go ahead first and sanitize. And after I sanitize, I'm gonna go ahead and just rip one of my alcohol pads and wipe down my vials. Okay, now that that's done, I'm gonna go ahead and take out my syringe. Also, like I mentioned before, I would do my checks. I already mentioned it, so I'm just checking that this is for the right patient, right medication, and checking the expiry date on the vial itself, and then also checking the little sticker that should specify when it was opened, just to make sure that it is still within the 28-day period of when it was opened. And then doing the same check for this. So I'm gonna go ahead, just keeping my cap over here. So 22 units of air. Just gonna move that to the side actually. Okay, that's 22. I'm making sure I put 4 in this, and then I'm just gonna switch, like flip it upside down, and I'm gonna pull back 4 units. Just getting rid of any air bubbles. Okay, and then, okay, and then, so all together it will be 26. So I did the 4 of the other one, and then 22 of this. So 26 all together, as you can see. I don't have any air bubbles, so I don't need to get rid of it. But if I did, then I would. So I'm just gonna recap. Goodness, okay, that's good. So sanitize again before going in. This is my injecting pad. I would make sure I do my patient identifications to check their wristband, and then also I can ask them date of birth, first and last name. And once I check that and it clears out, open my second pad that I take with me with my injection, 2 inches away from my umbilicus, making sure that that each time when I do give the insulin that I'm rotating, wipe down, and then I'm just gonna toss it over there, and then I'm going to take this and inject 90 degrees. Not going too fast. Okay, once that's done, I'm going to just make sure that the safety procedure is on and that I throw it into my sharps container. And for post-assessment, just making sure I monitor signs and symptoms of hyperglycemia as well as ketoacidosis, and making sure that I'm monitoring their nutritional intake to make sure that they are eating so they don't become hypoglycemic after the insulin administration, and just monitor their exercise regimen. And then for patient teaching, same thing, that they monitor their nutritional and exercise regimen, and then signs and symptoms of ketoacidosis as well as hyper and hypoglycemia, and just educate them on the drug effects, so that'll enhance their patient knowledge and patient compliance. What's the time?